What I would tell patients is that you are the driver of the treatment bus. And really, like, as a provider, I have recommendations, but in the end, this is a conversation between myself and the patient of what is appropriate for them. I find a lot of times when there's disagreement in a treatment or a healthcare decision, it's due to a lack of information that's been provided. So I would encourage you in those moments to just ask for clarification or reason behind why that decision was made. Is there any alternative decisions to that? And is, that way you can determine if that's really best for you. If you truly don't feel like something's in your best interest or in line with your goals of care, you have the right to refuse that, and there's nothing wrong with doing that. And I just say, but do it from a place of, once you're educated and informed, that you can make that informed decision to decide what is best for you. So I actually really appreciated this question because it's something that you see often, and it's caregivers wanting to contribute. And the way that they feel that they do that is they basically kind of take over everything. This goes back to the bus driver analogy, where you're essentially the driver of the bus, and it's stressful, and there's times where you don't want to be that, and that's where a caregiver can really fill that role. But having those hard conversations, it doesn't have to, I would say, just approach it from, it doesn't have to be a hurtful conversation, but essentially just saying, I really appreciate you being here. These are the ways in which you can best help me. And just lay out A, B, C. And that might be so simple as, I just need help, encourage me to eat, encourage me to exercise, watching for any symptoms that I might be missing. But when it comes to the provider visits or treatments, I feel very comfortable in my ability to ask the questions and advocate for myself during that time. But I will let you know if I do need help with those situations. And I think most caregivers are really receptive to that feedback. And again, they're just trying to do anything that they can to be helpful to you. And they will create their own way of doing that. And I think they really appreciate, actually, when you give them guidance on what you truly need. And that will change on a daily basis too. There might be times later in treatment where you're like, I'm exhausted, and these were the questions I had, but I'm going to forget them due to chemo brain. Can you help me remember these, or can you ask these questions? And I think you'll find that they'll be really receptive to that feedback. But never be afraid to advocate for yourself, just like you would with your providers. Do that with your caregiver groups and just say, this is what I need and this is what I don't need. And I think we're all afraid of offending people, but it's your treatment. And so never be afraid to advocate for what's best for you.